Welcome to this explainer. Today we are unraveling a genuine medical mystery surrounding a really severe complication in knee replacement surgery. We're looking at some cutting-edge retrospective data from a massive 2025 orthopedic study that fundamentally challenges who we think is most at risk for post-surgical complications. Seriously, if you think being young and fit guarantees a perfect recovery, you are definitely going to want to pay close attention to this.
Let's kick things off with a pretty staggering number, 1,033. That is the exact number of verified cases of the crippling post-surgical complication we're examining today, isolated right out of a huge surgical database. This isn't just a handful of random anomalies, right? We're talking about a significant group of patients whose post-operative lives were severely impacted by a condition that literally turns a routine recovery into an incredibly painful ordeal.
So what exactly is this complication? It's called arthrofibrosis. To put it simply, it's a severe stiffening of the joint. It causes intense pain, severely restricts motion, and it actually affects up to 10% of primary total knee replacement patients. And what makes this study so authoritative is that these cases weren't just guessed at based on symptoms. The diagnosis was strictly verified by analyzing fibroblast cellularity in actual tissue biopsies taken right during surgery. We're talking about aggressive scar tissue formation proven on a cellular level. It really becomes a race against the clock for clinical teams. The timeline goes like this. On post-op day 1, the protocol demands intensive physical therapy aided by local pain relief. By day 14, the clinical goal is a 90-degree bend. But here's where the path branches. If aggressive early physiotherapy fails and that knee stays stiff, patients have to undergo manipulation under anesthesia. And if 3 months pass without any real improvement, they're facing a highly costly, painful, and complex revision surgery. To solve the mystery of exactly who gets driven down that dark path toward a revision surgery, researchers analyzed an absolutely massive cohort of over 40,000 patients. They sifted through 25 years of surgical data, applied incredibly strict exclusion criteria, and compared the patients who developed severe stiffness against those who had a perfectly normal recovery. This massive sample size is exactly what gives this data such incredible authority. Moving into Section 1, the twist, surprising suspects. Here we'll decode demographic data and shatter some major medical myths.
First up, let's look at the data to bust a massive clinical myth. You might have seen previous smaller studies that pointed the finger at female gender as a risk for postoperative stiffness. However, when we zoom out and look at this huge data set, the proportion of women to men who got arthrofibrosis was exactly the same as the proportion in the healthy control group. This exact split proves once and for all that gender makes absolutely no difference in your risk profile. Men and women are equally susceptible.
Okay, here is where things get really counterintuitive. Being younger actually increases your risk for a stiff knee. I know, it sounds totally backward. As an orthopedic surgeon looking at a healthy 55-year-old versus an 80-year-old, your instinct is naturally to worry about the older patient. But the data definitively shows that youth is a major risk factor for this specific fibrotic complication.
Well, why does that happen? Because young patients have incredibly robust immune systems. Their bodies essentially overheal the surgical site. When you cut into a joint, the body mounts an inflammatory response to heal the trauma. In younger patients, this response is so powerful that it triggers a massive inflammatory cascade, leading to a runaway train of excessive scar tissue. Older patients, who naturally have a slight decline in immune function, simply don't mount the same aggressive scarring response. And the twists just keep coming. Leaner, thinner patients are also at a significantly higher risk compared to heavier patients. Again, this completely breaks traditional medical intuition, where a high body mass index is almost always the red flag for surgical complications. It all really comes down to biomechanics and activity levels. Think about it. Heavier patients often experience earlier thigh-to-calf contact when bending their knee. That physical contact naturally restricts their motion early on, meaning any minor stiffness remains unnoticed or subclinical. Meanwhile, thinner patients are often much more physically active early in their recovery, putting significant mechanical stress on the new joint. And in the world of cellular biology, mechanical stress is a known promoter of fibrotic scar tissue formation. Next up is Section 2, the silent trigger, DVT, which acts as a massive catalyst for joint stiffness. So demographics aren't the only suspects in our medical mystery. Having a deep vein thrombosis, or DVT, which is a blood clot in the leg, gives a patient an odds ratio of 2.21. In plain terms, experiencing a DVT more than doubles your chances of developing severe, crippling arthrofibrosis that requires a revision surgery. Why is a DVT so dangerous for joint mobility? Because it kicks off a massive localized inflammatory storm. But even more importantly, the blood clot restricts oxygen to the limb, a condition clinical teams call hypoxemia. When those tissues are starved of oxygen, it directly drives the aggressive formation of the extracellular matrix. Basically, the lack of oxygen commands the local cells to rapidly build dense, restrictive scar tissue.
That brings us to Section 3, the rheumatoid arthritis paradox, where we discover a highly protective comorbidity.
This is honestly the most baffling finding of the entire explainer. Counterintuitively, patients with rheumatoid arthritis have a drastically reduced risk of post-surgical stiffness. An odds ratio of 0.25 means their risk is literally slashed to just a quarter of a normal patient's risk. We're talking about a disease famous for causing severe joint inflammation, yet in the context of knee replacement recovery, it's incredibly protective.
So what's the secret? It doesn't lie in the disease itself, but actually in the medication used to treat it. The chronic use of powerful immunosuppressives like methotrexate, biologicals, and corticosteroids actively dampens the body's immune system. Remember how a young, robust immune system overheals and causes scars? Well, RA medications suppress that exact inflammatory response, effectively stopping fibrosis and scar tissue dead in its tracks.
Putting this all together gives clinical teams a fantastic visual cheat sheet. On the danger list, we see DVT, younger age, lower BMI, and even nickel allergies driving up the risk. Meanwhile, on the protective side, we see rheumatoid arthritis acting like a biological shield, along with conditions like tumors and atrial fibrillation, which makes sense, likely due to the heavy pharmacological management and immune-compromising nature of those diseases too. Finally, let's wrap this up with Section 4, our action plan for clinical teams, looking at evidence-based protocols to prevent revision surgeries.
So how do orthopedic surgeons actually put this into practice to ensure a successful recovery? The clinical checklist starts with aggressive day 1 physical therapy, powered by localized pain relief so the patient can actually tolerate the movement. Step 2 requires hypervigilant DVT monitoring. Surgeons absolutely must use blood thinners and constant screening to stop that oxygen-depriving blood clot before it even starts. And Step 3 requires a shift in preoperative consulting, making sure surgeons specifically identify the young and the thin as their highest risk candidates for stiffness.
Now, if you're a highly informed patient preparing for surgery, this changes the whole narrative. Imagine a young, thin, active patient who assumes they'll just breeze through recovery, so they slack off on their painful early physical therapy. That is the exact recipe for aggressive scar tissue. Understanding this data means realizing that your robust health is paradoxically your biggest enemy here. You have to work even harder and push through the discomfort of early physical therapy to guarantee your joint stays mobile. We're going to leave you with a final provocative thought today. If a robust, overactive immune response is the real enemy causing arthrofibrosis, how can modern medicine safely mimic the protective, immunosuppressive effects of rheumatoid arthritis medications for every patient without exposing them to other infection risks? Solving that balance might just guarantee a perfect, pain-free recovery for every single knee replacement in the future. Thanks for joining us for this explainer.